All right. So, dear friends, these questions that we're going to discuss now is basically the recall based, and the language of the question, maybe the options may be having differences from the original questions, or maybe the images may be different. So, wherever you find any difference, you please let me know. And after having discussed these questions, these are as per the recall, and answers might change if you change the language or you change the marking on the images or something. So, after we are done with the discussion, okay, or at any moment, you can just tell me where you find any differences, okay? So that is what. All right, dear friends. So let us now start this. And this time, what I have observed that a lot of questions were there from the embryology, right? In INI, there is a pattern that they ask more questions from first year subjects and the second year subjects, or you can say pre and paraclinical subjects. And also there is a pattern that they have been asking more of cadaveric images, and we have put the cadaveric images in our eMedicoz app for your preparation. Okay, in the image based section, if you go in the, under anatomy, there are two sections. One is the regular images, that is the non-cadaveric one, and one is the cadaveric images section. Or I have shared my all the contact details. Again, at the end I will share. So if you find any difficulty, you can ask me all those queries. Okay, so this question, let us start with the questions of this paper now. First, formed by the migration of the epiblast cell. Answer is endoderm here. Why? Because what really happens when there is formation of the primitive streak, in the primitive streak there is a groove, and our epiblast cells, they will first migrate from epiblast, they will reach the hypoblast zone. When they reach the hypoblast zone, they will replace the original hypoblast and they will be making the endoderm cells, right? And the same process is repeated. And after that, the endoderm will be pushed. The second generation will be formed by the epiblast cell as mesoderm. So first to be formed is endo, followed by meso, and then few cells which will stay back. They won't move. They will make the ecto. So the order or sequence, you can say endo, meso, ecto. All right. Straightforward question, straightforward answer. Next question. Mitochondria. This time they have asked the question on the spermiogenesis, and answer will be middle piece. Here let me show you. This is the spermatozoa, and here you can see the head is there, and above you can see this acrosomal cap is there. The head is formed by the nucleus, and the acrosomal cap is formed by the Golgis, because it is having lots of enzymes, okay, which are required to create a hole in the zona pellucida. This middle piece, and it is specifically written spiral mitochondria. Okay, these points we discuss in the general embryology, where we discuss the gametogenesis and followed by the fertilization onwards. So the most of the questions this time have been asked from the general embryology itself, right? The centriole will play two roles. It will be making deck as well as the tail. So this process where the round cell is converted into the spermatozoa, where the change of shape is there as well as the rearrangement of the cell organelles is also there. This step is called as spermiogenesis. This is one of the step in the whole process of spermatogenesis. Okay, dear friends. Now this question again from the general embryology. Oocyte is arrested in which phase of meiosis at birth? Yes, what's your answer? Straightforward. We can say diplotin. We can also say dictyotin. Okay, dictyotin or diplotin stages are having the same meaning is same. The only difference is the embryology book says diplotin, the gynae book says dictyotin. You can say the clinical book says dictyotin. Otherwise, they are meaning the same. So let me describe this part. What we are looking at right now is a section of the ovary where we can see these are the small follicles which are in the resting stage, primordial follicles. These follicles are seen in different stages like Some are in the primary stage, some are in the secondary, tertiary stages and all. And then there is ovulation. After ovulation, getting converted into corpus luteum. Corpus luteum may persist if there is a pregnancy, or if there is no pregnancy, then it won't persist, right? Now, this is just to show you how the events will take place. Initially, in the ovary, like the surface epithelium cells are the host cells. They are the self cells of the ovary. But then the guest cells, the cells which are coming from outside, are these oogonia. These are primordial germ cells. They are coming from outside. When they reach here, that name will change and they will become oogonia, right? And initially they will be given shelter as a like a group will be given in a common shelter, but then they are given individual shelter. Individual shelter means they will be surrounded by the follicular cells. So one oocyte surrounded by follicular cell is called as one unit, and the name of the unit is primordial follicle. So basically, when the female baby is born, all both the ovaries are loaded with primordial follicles, where the primary oocyte is in the resting stage, that is the diplotein stage, right? And at birth there will be no change. During the you see growth, there will be no change, but at the time of puberty, the hormonal changes will be there. First to come is FSH, right? Then few follicles will start to grow, 15 to 20 in each cycle, and they will become primary follicle, secondary follicle, and the tertiary follicle. And the LH surge will come. Now this LH surge, which comes just before ovulation, around 36 or 37 hours before ovulation, that will break this arrest, and the secondary oocyte in the meiosis 2 stage will be ovulated. Now this is what we can see, these follicles, and this is how they will be eventually released. Now another question, again from the general embryology, it has marked some structures were given. This is the development of the nervous system. Yes, what have you marked, students? What have you marked over here, dear friends? In this diagram, this is the development of the nervous system going on. The neural tube is getting formed over here. But the structures which have been marked is the neural folds, because when the neurulation is taking place, there is a ectoderm over here, endoderm over here, and the mesoderm in between. And here we have the notochord. Notochord, it induces changes in the above lying ectoderm and it becomes neural plate. The neural plate will start folding on itself, and that is called as neural folds. And the neural folds will meet and the neural tube will be formed and it will be separated. Based on the neurodegeneration, always there's a question, like they keep on asking question on the anterior neuropores, posterior neuropore. What will happen if the neuropore fails to, you see, close? Or there was a question once that in which week this is all happening. So this particular topic as a whole is very, very important for us, right? Now this is what I have provided you with, the whole of this marking labeling, so that if at all you see that marking was somewhere else, so you can see what structure was marked. Accordingly, that would have been the answer, and what recall I have got, according to that, neural fold can be the answer. Okay. Next question, the derivative of the neural crest cells. In all my classes, I always say that three lists are very, 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 very important. That is the pharyngeal arches, pharyngeal pouches, and the neural crest cells. So among these options, what have you marked? Neural crest cells among all these things are very, 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 very important. Now, let me tell you, answer among these will be retinal pigment epithelium. I have given you this mnemonic MO passes, where the see, melanocytes, odontoblast, all ganglia will be coming from here. Adrenal medulla. We know the Schwann cell, spiral septum, which is the conotruncal septum. conotruncal septum, even the endocardial cushions, AV cushions, etc., skull bones, or you can say the head neck mesenchyme. Head neck mesenchyme also involves certain components from the eye itself. So from the eye itself, then I like iris. Iris is also having the pigment, but that will be coming from the neural crystals. Even there are the like ciliary muscles and other structures will be coming from the neural crystals, but the retinal pigment epithelium will be coming from the optic vesicle part. Okay, the optic vesicle part can make the retinal pigment epithelium and the non-neural component as well. So, and one more question was based on this structure, that this angiogram was given and you were asked to mark the like supposed to, you see, identify this artery. What was the artery? As per the students recall, that was superficial temporal artery. Superficial temporal artery will be seen where? Let me zoom in. So we have these areas to identify the arteries. Okay, if you check here, that will be the carotid pulse over here. Okay, and if you check over here, that is what you can see is your facial pulse. But superficial temporal you can check either in front of the tragus part, you here you can check, or just related to the pterion. So in this response to the pterion, outside the pterion, not deep to the pterion. Deep to the pterion will be anterior division of the middle meningeal artery, but outside the pterion, this particular location, you can palpate the anterior branch of superficial temporal artery, right? So these are important areas from where we palpate the different type of pulsation, and this will be superficial temporal only. This pterion is particularly very important. Lot many time question has been already asked. आपने पहले भी देखा, हर बार हम जब भी रिकॉल करते हैं टीरियन पे क्वेश्चन आता ही आता है, टेंडनबर्ग पे भी आता है, इस बार भी आया है, बहुत सारे क्वेश्चन डायरेक्ट रिपीट टॉपिक्स में से हैं, राइट? अब ये टीरियन टीरियन पे एक पहले भी क्वेश्चन आ चुके हैं, दिस बार ये क्वेश्चन, ये तो पूरा ही कॉपी था लाइक लास्ट टाइम. So we know even the revision program, when we were discussing the INI predictor series, that time also I showed the same image and I told you you must remember three important points. Deep to the pterion is anterior division of middle meningeal artery. This question is usually asked. Then if they ask the bone, then answer will be lesser wing of sphenoid and stem of lateral sulcus. So A will be the answer among these, right? Here you can see this is the part pterion, deep to it is the lesser wing if they ask the bony area. Otherwise artery we know, anterior division of middle meningeal artery, that will be outside the dura but deep to the bone. And then this is the lateral sulcus. You can see the stem of the lateral sulcus is relevant here, right? Now this question was marked. This question was there, dear friends. Can you please comment on this particular question? Because some students are saying that there was cavernous sinus was visible. Some students are saying that this was some marking were there in the nerves. So I have not received a proper image, but if at all this image was there, the students are recalling that image was from above and the superior orbital fissure was seen, cavernous sinus. Some students are saying that it was there, some students saying it was not there. So can you please tell whether it was there? And anyway, most of the students are saying the marking was there on the third nerve. Anyway, we can just learn here that is a cribriform plate, and this particular topic we keep on learning in our regular classes as well, right? Because we start the first day anatomy with the head and neck chapter, and this is the first topic for a man of skull. Here we have the cribriform plate. Okay, here's the optic nerve, this is the oculomotor nerve, and this will be the trochlear nerve. I told you the thinnest and thickest are close to each other. This is the fifth nerve, very easy to identify. And also I told you one thing, that we are going in this way, but next nerve will not be fifth, next will be seventh and then eighth. Where is sixth gone? Here. Why? Sixth is going in frontal. Why? Because sixth is going to pierce the dura. It will enter into the dural canal known as Doralus canal. Do you remember that? And in this jugular foramen we have 9th, 10th, 11th nerve, hypoglossal canal. Over here we have the rootlets of hypoglossal nerve. So far so good. So accordingly, if at all, as per the recall, I am going to mark the answer as third nerve. But as I said, we have discussed the whole topic. if this image was there, you can consider this, or you can let me know that image was different or something. You can share also with me like what image was there and what according to you was the language of the question. Okay. Now this is, if you remember, whenever we discuss the questions after we have finished the upper limb chapter, particularly after the discussion of the radial nerve, I always told you that nowadays middle meningeal artery is hit or kind of in these days. But few years ago, there were back-to-back questions on the pin, posterior interosseous nerve. Do you remember? So now the day has come again, because you see what happens. They keep on asking from the same set of questions. Posterior interosseous nerve. तो व्हाट डिड आई से इन द क्लास, अगर आपके एग्जाम में क्वेश्चन आए आंख बंद करके फिंगर ड्रॉप, ओनली फिंगर ड्रॉप कैन बी जस्टिफाइड बाय posterior interosseous nerve injury. One more important point, this posterior interosseous nerve lies in relation to which bony landmark? Any idea, beta? This is a deep branch of the radial nerve and it is present next to neck of radius. All right. And the other options are not justifiable here because wrist drop will be not there, because for the wrist drop it will be not normal working or not drop, because the ECRL is paired at this level. ECRL is paired, and so far as extension of elbow is concerned, at the level of posterior interosseous nerve, the triceps is not supplied by the posterior interosseous nerve, it is also spared, so extension of the elbow will not be affected, it will be completely normal. Abduction of the fingers is done by the dorsal interossei muscle. Dorsal interossei muscle will be supplied by ulnar nerve, so that will be again not a choice here to be considered. This question, straightforward answer, buccinator, because buccinator is a muscle of facial expression. There is no doubt about that. Blowing and all those whistling and all, the buccinator is the muscle for those actions. But you see, we when we talk about this buccinator, it is considered as accessory muscle for mastication. Why? Because the process of mastication is not done by the buccinator, that is done by the muscles of mastication, which are supplied by the mandibular nerve. But the food which is stuck between the you see the gap between the teeth and the gum, that the food will be pushed by the action of the buccinator. That means it puts the food in the line of chewing, right? But it won't do the chewing action itself. So it is excessive muscle of mastication for that particular part. Which structure will pass through the gap between superior and middle constrictor? That is, again, we know that we have certain gaps, and we have remembered also what structure will pass from which gap. So right now we are talking about the second gap. First gap is between the base of skull and the superior constrictor. The second gap will allow stylopharyngeus along with its nerve. And let me show you the diagram. Here we can see the stylopharyngeus muscle, which is passing between the superior constrictor and the middle constrictor along with its nerve, even though the nerve is not shown in the diagram, but that will also be passing from the same gap. Now, one question which I have got is the opening in the inferior meatus. Even without the choices, without the option, we know there is one structure, that is nasolacrimal duct, that will be opening in the inferior meatus, right? Nasolacrimal duct will be the answer. And we know all other options as well, because we have discussed what structure will be opening where. In the hiatus, we have the mnemonic fam, frontal, anterior ethmoidal, and you see the maxillary. And then we have ethmoidal in this line, they are present, anterior, middle, and posterior. And highest meatus, we have sphenoid, or you can say sphenoethmoid recess, right? For the highest meatus, another name is sphenoethmoid recess. So these were the questions, right? So there was one more question which was based on just a moment, let me just check. Okay, so there was one more question, I believe, that was based on Trendelenburg this time. Okay, so Trendelenburg test was also asked. What will be the answer for that question? So there was a question on the Trendelenburg. On the supported side, we know that this is the pelvis and this is the gluteus medius and minimus muscle. Okay, if this foot has been taken off, this is the unsupported side. There is tilt because of the gravity, but this side muscles will keep on working and they will prevent the tilt over here. Which muscles will be working? Gluteus medius and minimus. But if you have to choose, go with gluteus medius. That was also one of the question this time, right? So that's all from my side. This is what I could collect. And if you find any discrepancy, as I have already told, feel free to ask me that, like then I can change and I can prepare with the proper language and the image. Okay. Thank you so much, everyone. Take care. Bye bye.